It's May 19th. We're here with Humboldt County Health Officer, Dr. Teresa Frankovich. Thank you for being here with us.
Thank you.
We wanted you to talk a little bit about the updated shelter-in-place order that talks about allowing designation of lower-risk businesses and activities related to Stage 2 of California's roadmap to modify the stay-at-home order.
Sure, happy to do that. I did want to just take a moment and again express our sympathies to the family of the resident of Alder Bay who passed away this morning. Our community is certainly thinking about you.
Absolutely.
So in terms of the shelter-in-place order, again, I just want to point out that the outbreak that we're seeing in our assisted care facility and certainly our losses related to that outbreak are just an important reminder to us again about the fact that as we ease out of shelter in place, which we must do as a community, that the efforts all of us make to help protect people who are older and more vulnerable are critically important. And so when we ask individuals to mask, to socially distance, to not gather in groups outside their family unit, there's a really big reason to do so, to ask that from our community. And I would hope that we all take care of each other in that way. So the order itself it's actually a supplement to my previous order. And it really just basically goes through the fact that where we are right now, the variants that we applied for through CDPH to allow us to navigate through Stage 2 at a local pace. And frankly, that's important because we not only gives us the ability to move more quickly as conditions on the ground allow, but it also allows us to tailor our response easily if we have concerns about what's happening in terms of our case numbers. So I think that what we basically outline in the order is what this variance allows us to do. We just have a brief list of what the governor has already listed as sort of a statewide ability to open. And so, including some of the sports things we've talked about, like golf and tennis, childcare, some office spaces that don't serve customers, as well as retail businesses that operate curbside or delivery. And that includes restaurants under there. What our variance allows us to do is to basically take all of those and to perhaps add something to that. So what we are asking now is we've put in place a process where, for instance, those businesses that are allowed by the governor's order and those businesses that have been operating curbside or delivery retail businesses, that they can actually go to our information site to humboldt.gov. They can pull up their sector that their business falls in. They can pull up the guidance right there for their sector in terms of a safety plan, and then they can put their application, their plan basically right online so that we can take a look at it, make sure that they meet those guidance criteria that the state and Cal OSHA have provided, CDPH and Cal OSHA. And really the purpose of that is it's really the idea of trying to create as safe a space for both workers and the community as possible during COVID. And I think the fact that the business has provided that plan and we've looked at it is a source of reassurance to the public and to workers. So I think it's an important thing to have done. And also because in this process, we're able to also provide back feedback to the businesses. So if they it's not intuitive to everyone about how to do this easily. We put a lot of information to support it out there so that people can use that resource, but we still understand in someone's particular business, it may be more difficult for them to think about how that could look. And so we're happy to help with that. If people put their plan in and it looks like there's some issues or they put in questions, we can get back to them and help with that. Again, the goal is just to create the safest environment possible for everyone. So what we're doing is we're approving those plans. My understanding is at the start of the day today, there were over 230 that had been approved, including some childcare, office spaces, as well as retail. And we expect that process to continue. At the same time, we're closely monitoring all of our epidemiologic data. That goes to things like the trends in the number of cases that we're seeing, how many clusters of cases do we have, how is our hospital capacity looking, how is our contact disease, communicable disease tracing going, do we have capacity in those areas? And right now, Our hospitals, our contact tracing, we do have capacity. We're doing well there. Certainly, we're seeing more cases than we've been seeing, and I think, again, that probably reflects the fact that the community, certainly some individuals in the community, are being more active outside their home. And again, it goes to the point, we're opening things up a bit, but we're still asking that people, for the most part, stay home, except to access essential and some low-risk business services. Medical care, for instance, falls under essential services. And just to limit that traffic, other than accessing those services and recreational opportunities for their family. I want to emphasize again that at this time, travel should still be essential travel only. We are asking people not to travel in and out of the area recreationally. It introduces risk into our community, introduces new case numbers, and then we have the potential for having many, many cases associated with that single exposure. So again, I want to remind people this is not a removal of our shelter in place. It's a modification of our shelter in place. And we're doing so in a very thoughtful and deliberate manner for a reason. And so I really, again, just ask for everyone's cooperation, because it's only going to be successful if we do cooperate as a community. If everyone does sort of what they feel is right at the moment, and without doing it in a planned sort of way, we have the potential for more disease transmission, more rapid transmission, and the possibility of putting not only our more vulnerable residents at risk, but compromising our healthcare system. So again, we're asking everyone to work with us in this mission to kind of navigate through COVID as safely as we can.
Excellent. Thank you so much. And can you talk a little bit more about dine-in restaurants?
Sure. So I know the governor's put out some additional information about restaurants today. What I want to let people know is right now our restaurants are open for curbside and delivery only. Obviously, that will change. Where our aim is to get things up and running as quickly as we can. So stay tuned for more information on that. But right now, our status has not changed.
Excellent. Thank you so much.
Thank you.